This is Well, Australian women. Welcome to your full body health check. I'm Claire Murphy. I'm a journalist who just wants to get to the bottom of all the things.
And I'm Dr. Mariam, the GP, who will tell you how it is.
Love that. On the way for you today in the checkup, we're getting into something that I've just realised is starting to impact more and more people around me. Yes, anxiety and depression. We'll find out what therapies work, how to deal with the very real physical symptoms like that awful, sweaty, racing heart, fight or flight situation that you sometimes find yourself in, and how to manage when you are at the lowest point of low. In the quick consult, Soraya has asked us about potentially inviting Bob into her home, and she doesn't know what the healthiest option is for her vagina. Now, Bob, for those who are not across the lingo, is your battery-operated boyfriend.
The reliable boyfriend.
The reliable man in your life. But first...
Succeeds every time.
It is a very successful man. But first, ladies using HRT, the gel that most of us are using these days actually has a weird effect on our pets. Seriously, let's go to med school.
Welcome to med school.
Here's the thing, so many of us are now using estradiol gel because we're hitting perimenopause and we need it, but also because the patches that a lot of people were using are low in supply, they're out of stock everywhere. And I was reading this article explaining how if you do use the estrogen gel on your arm and your pet licks it or comes into contact with it, even from like sleeping next to you in the bed, for example, they can get estrogen toxicity. There was a case in the UK of a Jack Russell that seemed to be going into heat. She'd been desexed and so shouldn't be able to do that. Lily, a 12-week-old Dachshund, went into season, 12 weeks old. Oh. And they believe that it was linked back to their humans using the estrogen gel. So if your animal is a girl, it might get swollen mammary glands and vulvas. Boy pets might develop mammary glands and they may get an enlarged prostate. So the thing is, if you are on this form of HRT, you've got to be really careful. You've got to wash your hands after you apply it. You've got to cover the area with a sleeve if you can. Don't let your pet lick your arm. Don't sleep with your pet next to you if your arm is exposed. And if they do come into contact with it, don't let it lick itself. You've got to rinse them off. The good news is they do get better pretty quick once they're no longer exposed to that gel. Mariam, the knock-on question, I guess, from that is, do we have to be concerned with the other people in our homes who might come into contact with us when we're using estrogen gel, like our partners or our kids?
Yeah, definitely. So not just to pets, but to also the people around us. Yeah, so the risk for humans is generally lower than that of pets, but it's still wise to take precautions, especially for children, because they're a lot more sensitive to those hormonal changes.
Okay.
So yeah, to reduce that risk, do all those things that you mentioned. I always tell my patients to apply to areas that are less likely to have contact with people, so the upper arm or the inner thigh. Wait 5 minutes to allow it to dry before covering it up and washing your hands immediately with soap. And for safety measures, always, storing it in a place that's not accessible for children as well, out of reach. And if it has been transferred to another person, just wash it off quickly with some soap and water.
It's time for the checkup.
All right, it is checkup time. The focus of today's conversation is a couple of really unwelcome guests. We're talking about anxiety and depression. Mariam, we did some research at Mamamia and found that 68% of Australian women, so nearly 7 out of every 10, and if you think about the women around you, if you experience this, then so do 6 of your mates, identify as having a mental health condition, and the most common one that they are experiencing is anxiety, followed by depression. Can you explain how you in your practice would identify anxiety in someone who comes to see you, and then how that might differ from someone suffering from depression?
So with anxious patients, when they come in, I'm often noticing restlessness. So they're fidgeting, they're irritable, they may be talking quite fast, they might be complaining of physical symptoms that we see associated with anxiety, and that's like palpitations, nausea, dry mouth. They might have hot sweats, tremors, shortness of breath, or a lot of digestive issues, muscle tension. And then when we start to explore the symptoms of anxiety, they might be complaining of worry that's really difficult to control. They're fatiguing quite quickly, and that's because they're always on edge. Trouble concentrating, irritability, and then sleep disturbances are a big one. So, those thoughts just keeping you awake, you're finding it really difficult to fall asleep and stay asleep. So they're the big things. But on the other hand, depression, they're more likely to be flat during the consultation. A lot of the time with my depressed patients, I usually have someone come in with them and saying, I'm worried about my friend or my family member, or they've come in because someone said they're worried about them. That's generally the case I see with depression. So yeah, they're flat, they've got reduced affect, they've got poor eye contact, they're kind of slow with their speech. They might be tearful or emotionally numb during the consult. And their common complaints, they feel just persistently low, they feel hopeless, they don't feel any worth. They're unable to find pleasure in activities that they previously, like their hobbies. They might have thoughts of self-harm or suicide. There might be changes in weight and appetite. They might feel like they just want to stay in bed all day. And they have negative thoughts about themselves and their future, whereas anxiety centers on fears or concerns about upcoming events or potential threats or the fear of the unknown. I also assess the symptoms and the duration and the effect on their quality of life. So it's also important to note that anxiety and depression can go hand in hand, which can make it a little bit more difficult to treat. So it's really important to seek help early if you feel like you're experiencing any one of those conditions.
What's really interesting, I find, is that anxiety can appear in so many different ways. So like both you and I have experienced it in different ways. So mine is premenstrual anxiety, which only kicked in when perimenopause arrived. So it felt like for a week before my period, I couldn't breathe properly, and I was constantly getting that dump of adrenaline into my system all the time that made me feel jittery and like I couldn't rest. And so what does it feel like for you?
For me, anxiety has really been exacerbated by being out of control. Like I've mentioned, one of my sons is autistic, and it's like that unknown, about his future and what it's going to be like, and, the challenges that might be coming around the corner. So it started for me with that lack of sleep and constant worries just kind of keeping me up, and then that on edge. And it can be really debilitating. I remember I was out at the play center with my sisters and their kids, and I was just so tense. And they were like, your anxiety is actually palpable. Like, we can feel it. Like, you need to seek help. So you don't want to get to that point. So if you're experiencing any of those symptoms we've described, I would definitely encourage you to see your GP.
I also have friends who suffer medical anxiety, which I didn't realize was a thing, because I've joked in the past about them just being hypochondriac, and that is obviously not the right thing to do. But so if you are listening to this and you have medical anxiety, like, I get it. We don't want to scare you, but you've got to make sure you go to the doctor and get it checked out if you are concerned. But when you do go to your healthcare specialist, what sort of words and phrases can we use to advocate for ourselves? Because especially if you're suffering from depression and you're at the lowest of the low, and especially too then if you've got it hooked in with maybe you're also suffering from anxiety, and then, as we mentioned last week, also with ADHD, which might be on board as well. That's a lot of things to deal with. So what can we say to our doctors that will make them understand we're going through all of that?
It's a great question. So advocating yourself, especially during a challenging time, can be quite difficult. So you can prepare for the consult. So write things down, things you've been experiencing, how you've been feeling, some thoughts, how it's been affecting your life. And then find a GP who subspecializes in mental health. So a lot of medical centers have websites, there's bios for the doctors, and it include information about their subspecialties. You want to book in a long appointment. I don't like seeing mental health patients in 15 minutes. You're not going to have a proper consultation in 15 minutes.
That's such a good point.
Yeah, and I usually do it over 2 or 3 consults. So expect that it's not all going to be, figured out in one session. And then I always encourage, if you feel like you might need a support person, bring one, someone you can trust and who can support you through the process. And it's completely okay to cry. I always have a box of tissue. You're not going to be the first and you won't be the last person to cry in a consultation room. With doctors with experience with mental health, we're very welcoming with all emotions. Obviously, not rage or anger. Please don't hit your doctors. That's not nice. I have had a chair thrown at me. That's another story.
Okay.
But yeah, so just be direct and honest. So like, I am feeling, I need support. I have been having bad thoughts, and describe the impact it's having on your life and acknowledge the overlap of conditions. I think the anxiety is making my ADHD worse. And be clear what your needs are. Like, I need support managing these symptoms, and make sure you leave with a clear plan. And that includes a safety plan. I never let any of my mental health patients leave without a safety plan.
Which is what?
So I always ask, like, okay, if you're having bad thoughts or you feel like, your mental health condition's been exacerbated, who are you going to call? Who's the first person you're going to call? It's after hours. You can't see your GP. And so you're unable to get through to that person. Who is the second person? Who is the third person? Who is the fourth person? And some people don't have four people. So then we put numbers down, like whether that's Lifeline, Beyond Blue, or one of the acute community healthcare services. So I don't leave until I've got like a safety plan of 4 or 5 backups. Sometimes I'll print them out and I'll make them stick it on the back of their phone or under the cover, so it's just easily accessible, make them put it in their notes. So that safety plan is really, really important.
All right, so we are going to talk a little bit more about anxiety and depression now. And I was really lucky to have a chat with Dr. Carly Dober. She is the principal psychologist and founder of Enriching Lives Psychology. She's also the former director of the Australian Association of Psychologists and Body Safety Australia. She specialises in trauma and eating disorders. And she's going to give us some more insight into how we deal with anxiety and depression, how to pick ourselves up when we're so very low or when we're in that real panic mode. Carly, thank you so much for joining us today. I think the main question that people ask when they are dealing with things like anxiety and depression is, what type of therapy do I need and who do I go and speak to get it?
Thank you for having me on. I love talking about this. I would say the most common therapy that has been shown to be very helpful for people is cognitive behavior therapy, CBT, and acceptance and commitment therapy, or ACT. These two interventions are really straightforward, really practical, and can support people to manage the symptoms of anxiety or depression. We also know that whoever you see, so a psychologist, a mental health social worker, it really depends on the therapeutic fit. So you want the person to feel comfortable, safe, and able to be challenged by the person that they're having these sessions with.
So if you go and see a therapist and it doesn't work right, that's not a sign that therapy is not necessarily for you. It could just be that you haven't found the right person yet.
Absolutely. And it can also be the wrong time, right? If you've got a lot of genuinely very stressful things that are very difficult to manage, therapy can be really helpful, but it's not a magic bullet.
Can you explain how cognitive behavioral therapy actually works?
For sure. So, say you're going to see a psychologist, start of CBT will always be a standard assessment where it goes into biological, social, environmental, and other factors that might be the reason that you are sitting in front of me. From there, I will develop a treatment plan and a case formulation that I will share with you to say, hey, you're saying that you're very anxious. This is what I think is going on. This is what I think might help you. What do you think about that? From there, it's a very staged approach where I will explain to you what the CBT model is, what anxiety is, right? Because anxiety is a word that's shared very, very often, but we need to have a really solid understanding so you know exactly what we're treating, you know exactly what anxiety looks like for you, and so you know exactly what anxiety is. From there, there'll be education and homework and in-session tasks that might challenge your thinking, expose you to anxiety-inducing situations, and to support you with specific strategies and skills to manage anxiety, life on life's terms. And then the end of therapy, there will be mental health maintenance planning or exit planning, where we say, okay, you're going to go off into the world now. Here is what you should be doing, putting time towards if you don't want to come back and see me again, hopefully, because that's ultimately what we want.
Well, that kind of leads to my next question. How long should you be expecting progress to start showing?
Ideally, in the best case scenario, where nothing big in someone's life comes and just obliterates their progress, we'd say about 12 to 15 sessions maximum, right? But unfortunately, often when we see people, big life things will come, or other things from their childhood or from their early adolescence will also arise that can sometimes lengthen therapy, but we're probably looking at that 12 to 15 session maximum generally.
When we're talking about anxiety and depression, what would you say are the most common triggers to start off about, and how do I identify my own triggers?
So triggers can be environmental. So it could be something at work, at school, within your friendship or family groups. It can be physiological. So low mood or very, restless, poor sleep. It can be mental. So particular thinking styles. So catastrophic thinking, for example, or thinking that the world is out to get you, which may or may not be true, depending on who you are and what your life is like. Triggers can be very, very broad, and some people can have multiple triggers depending on how severe their symptoms are. I think about really being observant. Notice when your mood is starting to shift or when your symptoms are actually starting to rise. How did you sleep that night? Did you eat enough food to get you through the day? For your brain to actually function well, have you been hydrated? Is there anything going on relationally for you? So with your partner, kids, friends, work, that is stressing you out. What is happening in your life that might be contributing to this? And is there a time that it's getting quite significant? Sometimes that insight can be very difficult because there might not be any discernible triggers, which can be really, really frustrating for people. And sometimes they're quite obvious.
What about the physical symptoms? Because we know that these are mental health conditions, but that doesn't mean it's all just happening within our brain, right? So, for example, anxiety, there's that real fight or flight response you get where all of your heart is racing, you're sweating. Like there's a lot of physical symptoms that can go along with this. How do we deal with those when we're already in therapy trying to deal with our brains?
You're right. There has been a false distinction between mind and body, and they are linked. Of course, they are. First line of intervention that we recommend for people who can is engaging in lifestyle changes. So behavioral modifications, including movement, joyful movement. You don't have to pick up marathon training if that's not your thing.
So this is where we see all those like TikToks of people like out just like stomping down the pavement because they're like taking a stupid walk for my stupid mental health. Yeah.
Don't knock until you try it. We know that even a 10-minute walk around the block can be fantastic for the brain. So, the silly mental health walk, it's golden. Swimming, dancing, whatever. If you can get outside, go to the gym, do a YouTube workout in your home, even for 10 minutes a day, that is very helpful. Any more? Fantastic. If you genuinely like the movement as well, you'll be more likely to stick to it. That is number one. Number two, please also don't underestimate the value of an adequate sleep schedule. With depression, we know that you can feel exhausted even though you might be sleeping 10 or 12 hours a day. We want you sleeping about 8 or 9 hours depending on, your usual sleep routine. And same for anxiety. The less sleep you get, the worse your mental health symptoms will be. We also want you focusing on good enough nutrition, right? Life is to be lived, but ensuring that you're having enough fresh fruit, veg, frozen fruit and frozen veg, legumes, nuts, seeds, everything that gives your brain the nutrition that it needs to work the most effectively when you're trying to get better. Also hydration. People can forget when they are depressed to drink water. And those four things are where I would say everyone should be putting their time towards. It's simple, it sounds too simple to work, but they are the most effective things you can start doing.
What role does medication play in treating anxiety and depression?
Some people do need medication and a combination of therapy to manage their symptoms that might be debilitating and quite severe. Typically, we would encourage people to try the lifestyle modifications first and a combination of therapy to see if this makes any difference. Some people do need that pharmacological help just to give them that final push, either short term, medium term, and in some cases long term. But basically, these medications, they can support either less or more chemicals in the brain that might be contributing to specific behaviours or moods.
Say I'm in between therapy sessions. Maybe I'm having, cognitive behavioral therapy. what do I do in between those sessions where I'm on my own?
Always ask your psychologist for homework. If you hate the word homework, ask for out of session tasks. But everything you practice and do in therapy should be done outside. I often say psychologists like to think we're very important. We're a very small piece of the puzzle, right? Because if you've got 1 hour in therapy every fortnight, you've got hours and hours outside of therapy to actually practice this stuff, to think about this stuff. That is where you get the bang for your buck, essentially, because we can talk about a lot of things, but if there's no behavior change or practicing these skills that will serve you, hopefully for the rest of your life, not much significant change can occur.
Yeah, we hate the word homework, but if it's to help our brains, maybe we should try and get over that, eh? What are the signs that I might need to seek immediate help? Like if I am maybe at risk of hurting myself, hurting others, or just not being able to function?
Firstly, we're looking at frequency. How frequent are these distressing, hopeless, or helpless thoughts or feelings? If it's most days, every day for longer than 2 weeks, that's probably a sign some early intervention is needed, or immediate intervention is needed, just because things can move pretty quickly with mental health and we don't want that. We're looking at severity. How severe is it? If it's 1 or 2 thoughts in a month where, oh, I wish I wasn't here because this is so stressful, I can't deal with it. Okay, that's passive, there's no plan. If it is thinking, I don't want to be here, people would be better off without me, this is how I would end my life, that again is a sure sign that you need some support. And duration, again, if it's longer than about 2 weeks, we don't want you feeling that way for any longer than you have been. So let's get you some support. And we're also looking at the impact on your functioning. Are you able to engage in normal routines and hobbies? Are you able to navigate your interpersonal relationships? Are you able to work? Are you able to cook for yourself? Are you able to shower and maintain your home? These indicators are pretty stock standard that someone might need support. And that's not a shameful thing. We can get you feeling far better than you currently are, but you do need to come forward.
If someone is in a real depressive low, and you mentioned there, like, is it going to interrupt your hobbies or the things that bring you joy? Like, how do you maintain motivation and interest in those things when depression is a thing that's kind of pulling you down?
Yeah, this is a very common thing that happens where people say, I don't care about meeting up with my friends anymore. I don't care about watching films, attending a book club, playing footy. Like you said, depression can suck the energy, motivation, and joy out of so many things. It, by design, takes a pleasure from what might have been a pleasurable life. A key part of depression support is engaging in behavioral motivation, where we say, yes, this is really bad, and that kind of cycle will continue without intervention. What we unfortunately need to do, and what sounds really paradoxical, is help you to engage in these activities again, because over time you will get more energy just from doing that. You will get something out of engaging in these routines. You will get more motivation. I know it sounds crazy, but it is, again, like gold standard treatment for depression. So I guess force yourself to do stuff, call on people that you love to help you to get out the door.
How do we deal with the feelings of guilt and shame that often come with things like anxiety and depression, and this idea that you don't want to be a burden on people?
Another super common one, and I really wish that, I think so many issues in therapy could be resolved if people just talk to themselves with a bit more kindness, or the way that they might talk to their kids or their best friends or their partners, right? Because people can be so harmful and cruel to themselves, and it just doesn't help, right? So I think firstly, notice the guilt and shame and then fact check it. Am I the only person in the world that's ever felt this way? Absolutely not. Unfortunately, anxiety and depression are the most common psychological illnesses around the world. More than 50% of people worldwide have one or both of these illnesses or have experienced them. While that's not good, you are not alone in this journey. And then challenge yourself. What's a different way I could actually talk to myself in this moment? What might be a bit more helpful for me in this moment? because shame will isolate you, and isolation is the worst thing for mental health. So we want you to move away from that pretty quickly.
How do we also get support for family and friends? Because we know that mental illness is not something that generally affects you and you alone. It will affect the people around you. Are there like support networks or therapy for people who have family members who might be going through things like this?
Absolutely. There are so many amazing national evidence-based peer groups, like SANE are an amazing national group that can support families, carers of people who have mental illness. But I say also encourage them to talk to their close and loved ones. So have these conversations with safe and trusted people. Turn towards community, encourage them to turn towards community, encourage them to seek out support from their quality health professionals as well.
Just finally, we often now source our health information from social media. What things or thing have you seen doing the rounds in your feed, because obviously this is your world, that you think's really damaging for people who might be suffering from anxiety and depression?
Oh my God, where do I begin? I feel like this is a whole episode in and of itself. I think some of the more damaging things are I see so much content, and I feel like a lot of my time in session is asking people where they found that information, not in a judgy, blamey, shamey way, but just in a curious way. There are people online telling you to only sleep 6 hours because you'll maximize your day if you sleep 6 hours. And sure, some people who might be neurodivergent don't need more than that, but generally having less sleep than you need is going to be atrocious for your physical health and your mental health. So please proceed with caution. Particular diets like an all meat diet, again, atrocious for your health and well-being. Oh God, there's just so much. Or even just really reductive bits of information like cutting friends and family off if you have a disagreement, where nuance is needed. For some people who might have had a really traumatic experience and that person is safe, yeah, okay, maybe cutting yourself off is the best for you and your well-being. But if it's a disagreement, rupture and repair are foundational skills to have as an adult or a person navigating life. And yeah, God, I could rant for hours, but I'm not going to.
I feel like you're not alone. Carly, thank you so much for sharing your expertise and insights with us today. We really appreciate it. Thank you.
You're so welcome. Thank you so much for having me.
That was so insightful. Mariam, what do you think about that?
Yeah, I really liked how she commented it has to be the right time with the right therapist. I often see patients come in, they're like, nope, therapy's not for me. I saw a psychologist, it's not for me.
Yep.
And I'm like, no, you just haven't had the right psychologist. It's really important that you vibe and you have that connection. So whenever I have patients come in, we do a mental health consultation. I send them to a great website, psychology.org.au. I call it the Tinder for psychologists.
Oh my God, I love that. We'll put that in the show notes too.
Yeah, and essentially it's just got a lot of profiles. So you put in the issues that you think you might have, whether that's anxiety, depression, acute stress, whatever it might be. And then you put in a postcode and the radius that you're prepared to travel to, or whether that's telehealth, and a whole list of psychologist profile will come up.
I love this.
And then I encourage them, have a look, if you're superficial and you're going to judge people based on appearances, there is a photo there. And then they've got a bio about themselves and what they subspecialize in.
Yeah.
And so read that bio. If you feel like, okay, I think this might be the person for me, then I always encourage them, give them a call, check if they bulk bill or if they offer gaps and what the gap payment is and what their availability is. Those things are quite important. If you're happy, book that appointment and then we can facilitate that referral. Makes a world of difference.
Amazing.
But yeah, so if you have tried psychology and it hasn't worked, I really urge you to try again with a different psychologist.
Because maybe it wasn't the right time and the right therapist.
That's right.
Thank you so much. What's that website one more time?
Psychology.org.au. The great thing is you don't have to go in to see a psychologist. There's amazing other options like Zoom calls or telehealth, which is really, really practical, especially for working mums or people that aren't able to see a therapist. And
or
get
if you just don't like sitting in a room with a human person and telling them all your inner workings.
From the comfort of your own home in your pajamas with a cup of tea. It's amazing. So I have something called TIT sessions.
Yes, we all have them. Oh, no, that's not what you're talking about?
No,
okay.
it's an abbreviation, therapy in Tesla.
So you sit in your car and do it?
I sit in my car
Amazing.
and do it. So I usually have like after hour sessions, obviously, because I'm working and I've got little ones at home. So I like step out 6 p.m. And sit in my Tesla and have my sessions with Eileen, who is bloody amazing.
Good on you, Eileen.
Right psychologist, right time. In my tit.
It is quick consult time. This is where we answer a question from Soraya today, but it could be your question too if you want to send us one in. She is about to make a very important first decision. We cannot underline how important this is about a battery-operated boyfriend. But what does she need to know about keeping him clean?
The doctor will see you now just through here to consult room 1.
Quick consult time. Mariam, please do your thing.
Thank you for waiting. How can I help you?
Welcome to today's quick consult. This is where you can have your health concerns heard. If you do have something you want to ask Dr. Mariam, she's very friendly, trust me, or any expert in the health space, make sure you reach out. Our email well@mamamia.com.au or leave a voice note. There's a little linky to that in the show notes alongside one that you can do it anonymously if sometimes these things are a little bit sensitive. In the doctor's office today is Soraya. She sent in this question for you, Mariam. Hey ladies, I'm thinking of getting my first vibrator, but I don't know what's the safest thing to get for my vagina. Does it have to be made from a certain material? And should I clean it with certain products like alcohol or antibacterial wipes, or is ordinary soap okay?
Soraya, I am so happy to hear.
We are very proud of you, both of us, very proud of you.
That you're considering Bob. And we know the sex toy industry is largely unregulated. So when choosing a vibrator, it's important to select one that's made from body-safe materials. So you want to look for products like medical-grade silicone, ABS plastic, or stainless steel, as these materials... Stainless Bob.
That's maybe like an elite level, Soraya. Maybe just start off with the silicone version.
Whatever floats your boat. As these materials are generally non-porous and they're less likely to harbour bacteria. So for cleaning, mild soap and some warm water are generally okay, but you don't want to be using alcohol or antibacterial wipes because they can be a little too harsh and degrade the material over time.
Okay.
Some toys are waterproof, so always check the manufacturer's instructions to ensure that you're cleaning it properly. And I will add, if possible, it's always a good idea to clean your vibrator before and after use to maintain hygiene, as STIs can be shared. And
really?
Yeah, you can get an STI from a sex toy. Yeah.
Okay, so if you are sharing them with somebody.
Yeah.
I did not know that.
Yeah, it can happen.
Thank you, Soraya. That is, and again, very proud of you for taking this big step. You absolutely, guaranteed will not regret it.
Yeah, I have to add, I don't have a Bob because my husband is sufficient.
Shut up.
Love you, babe.
Shut up. That's too cute. But also, I think you're a liar. Anyway, thank you for being here with us on Well again today. If there is a question or 7 that you want to ask our good Dr. Mariam here or any of our experts, send it in. That email again, well@mamamia.com.au, or you can always leave us a voice note. Next week, if you have ever felt like you can't get out of bed because work and life pressures are just too damn much, you might be experiencing burnout.
Yeah.
We are going to get to the bottom of what burnout actually is, how you recover from it, and make sure it never happens again. Don't forget to sign up to the Well newsletter. There's tons of expert health info delivered right into your inbox. There is a link for that in our show notes. And of course, as always, the advice you have heard here today is general. It may not suit your exact needs, so make sure you reach out to your own doctor or healthcare specialist to get the info that is absolutely right for you. And we will see you for your appointment this time next week.
I'm off to my tit now.
Enjoy your tits.
Bye.